I'm Dory Demers, and I'm the Rise Vermont coordinator. Rise Vermont is a community initiative to embrace healthier lifestyles, improve the quality of life, and reduce healthcare costs of where we live, work, and play. We are pleased to bring you Rise TV, a weekly syndicated show on Northwest Access Television, bringing us all tips, tricks, and resources to embrace a healthier lifestyle. We are thrilled that we are partnering with the Vermont Department of Health St. Albans District Office to offer these tapings as WIC-approved activities. Please be sure to listen for your WIC-approved phrase that'll appear at the bottom of your screen here and also be told by the co-host. This will be what you will have to report back to your local district office to get credit for your second nutrition education. If you'd like more information about Rise Vermont, head to www.risevermont.com or follow us on social media. I really hope you enjoy the show, and thank you for joining us in embracing a healthier lifestyle and creating a healthier community for all of us and generations to come. Thank you.
Hi, this is Jessica Frost from Rise Vermont, and today I have with me Jennifer Dusablo from Franklin County Home Health Agency, and we're going to talk about their path to being a Gold Certified Rise Vermont business. So welcome, Jen.
Thank you, Jessica. I'm happy to be here.
Do you want to tell everybody a little bit about your role at the agency?
Sure. So I work in promotion and development, so fundraising and PR, and I'm one of the coordinators along with the co-coordinator Tracy Osterhout, who was going to join me today. I'm sorry she couldn't be here, but we both help lead our wellness team at Franklin County Home Health Agency. So I'm here on behalf of the wellness team.
Well, great. Thanks for joining me. So I wanted to talk a little bit about where home health started. I had originally met with you guys back well over a year ago, and there were some wellness activities going on within the agency.
Sure. So we've always considered wellness a top priority. We are a healthcare provider in our community, so wellness is important to us for our staff and for the whole community. We want to be a model. So we were always doing activities, and we're proud of being recognized by the state for Worksite Wellness Awards for many years. And a lot of those activities were things that, we have benefits such as a $100 wellness benefit for benefited employees where they can use that money for reimbursement for activities, gyms, or nice new sneakers or equipment. So that was a good thing that's been in place. We've in the past, years ago, 10 or more years ago, I was on a wellness committee there at the agency, and it was very great, but it kind of fizzled out. It just turned into an HR kind of thing or a top-down management role. So we've more recently gotten back to the wellness committee kind of model. So, and when you came on, you were the beginning of that wellness committee coming back together. So yeah, we've always done some wonderful things at the agency, wellness-wise. Whether it's just supporting people taking their breaks and going out for a walk around here. We're lucky we're at the top of Fairfield Street. There's great routes we can go for walks, doing sort of a buddy system that way. We did a few years ago make an effort to make more healthy choices at agency-sponsored staff meetings and things. And there's always some chocolate or something fun because that's, it's balanced, it's good for you. But we did make a concerted effort to make sure that there's more greens and balanced on those meals. And we've always done some things like being breastfeeding friendly. We have breaks, and we would respect women's time at work to pump or breastfeed. But as we can talk a little bit more about becoming Gold, we took that a little further. So
yes, Home Health was one of the first businesses to be breastfeeding friendly in Franklin County.
Wonderful. Yeah. We love being the first in things. We're the first in many, and we're proud of that. And we have this really cute room that's comfortable and set up for moms, a lot of privacy, and we're proud to be able to offer that.
That's great.
Yeah. Of course, as an agency that provides support to new moms, it makes sense. We certainly want to model that for our moms too.
Yes, I remember when I came in for the first meeting, they really did we didn't have any businesses at Gold, and they wanted to be the first.
Yes, so thank you for helping us get there. We like competition, so getting to Gold was fun, and we really did utilize a lot of support from Rise and other partners to get us there, so thank you.
Yeah, you're welcome. And just so people know what we're talking about, we have these scorecards that we use when we go into businesses, and there's a bronze level, a silver level, and a gold level. So we come in and just see what a business is doing and where they're at with their wellness programs, and then we try to give them some tools and resources to provide more for them. So we'll kind of talk about the evolution that went on at Home Health so you can get some ideas of some of the things that you're able to do. So how has having a committee helped you guys?
So that's been huge. And in the beginning, our committee is multidisciplinary. So at Home Health, we have staff who are in office, billing, administrative. We have long-term care staff and therapy, nursing. So we have a lot of different people to choose from, and we want to make sure that we had a good reference of each team on the committee. So we've done that, but we built the committee in the beginning also using community partners. So you were there on the table, at the table, not on the table, and Amy Brewer from the hospital and the tobacco cessation efforts. We had our healthcare broker, our HR support, the Richards Group, and then of course our healthcare, our insurance provider, Blue Cross Blue Shield, was at the table, and they are really key part of our committee. So building all the right resources there and talking from the very beginning about strategies. So having a committee, one that's employee driven. There's some management at the table, but it's really staff employee driven. Was important because we recognize that wellness is a personal effort. Your wellness needs are going to be different than your coworkers, but everybody has some needs. We want to make sure that we recognize the personal journey. So having employee driven, and then being really strategy driven. So for years we said, oh, this is fun, let's do this sometime, or yeah, we're doing the healthy meals and that's good, but really sitting down and saying what are our needs and what are our strategies and how can we get there. Having a committee meeting monthly really helped us get to that point.
Yeah, I could see that. So it helps because there are a lot of little piecemeal things going on, and just to kind of bring it together and have it look towards a greater mission.
Yes.
And it's always good to have input from a big variety of people.
Yep.
Sometimes if it's one person, they think they love whatever they love and think it's a great idea, but maybe half the people aren't really interested in that.
Sure, and so to get to that, we, Blue Cross Blue Shield had a great tool, and there's many tools we could have used, but they offered us a health assessment online and a personal health interest survey. Mm-hmm. So we incentivized that for our staff to, take this survey and really get to know. It was confidential, but we did get some of the data from it so that we could say, this is where we should focus our efforts. And not surprisingly, a lot of the things that came up, eating well, moving more, stress less, those kind of things were coming up. So we had a lot on our plate. We got back together as a committee and said, here's where we want to focus right now. And we see this as an ongoing initiative at Home Health. So you don't have to do it all at once. You're going to focus and do some activities and do some stuff that's ongoing, and then do some challenges and fun things along the way. But yeah, I think so taking that health interest survey was a great place to start. If folks want to say, what should we focus our efforts on? So then we did. We finally pared that down to a more focused, our first, we sort of divided it in quarters for the year, but our first tactic was personal goal setting and accountability and achievement. So if you're going to do a wellness and you want to make some changes, goal setting was important. So we did some mini campaigns, and we're doing one right now, just kicking off on Monday, where I just show off a little, we made a little brochure, and inside is a log, and we have the dates, and you just make one simple goal a day. They get a point for doing so, some lessons learned. And this was just filled with some cute pictures of our staff doing wellness activities and being active. So we're doing this, and we're incentivizing our staff to get involved.
I love how they came up with their own logo as well. So it's Franklin County Home Health Agency Wellness, and they were able to choose what the picture looked like and really customize it for their staff.
Yeah, and Blue Cross Blue Shield helped us with that. They did the design, and our whole agency, got in on it. It was fun. People voted, and it's fun. So anything that we do, like we have some incentives, it's water bottles, we can print that on there and really show that wellness is a key part. Our staff can see that and know what their team's doing and what we're doing for staff. So that was fun. But yeah, so doing a goal setting campaign, encouraging people to make simple changes that will get them onto the next journey. So then following up from that, we're going to move into more activity-based, we're doing like a lessons thing. So for in the fall, we're going to have a series of classes on site, whether it be learn how to do Tai Chi, like very intro kind of classes, or here's a nutrition kind of course. So just bringing stuff on site because people were really looking for that. And then we'll move toward the end of the year as we get toward that whole beginning of the year and holiday food. We're going to talk about eating well more and really focus on nutrition. So those are some of our key components that we came up with right now to focus on.
That's great.
Yeah.
I was wondering if you wouldn't mind sharing the first challenge that you guys launched, because I remember it was only, I think, 5 days, and it just gave everybody a taste.
That's right. So it was very similar to this, setting a daily goal, but we said 5 days, it's all you have to do. So we wanted to make it achievable. So, and with that, yeah, many people did that, and it was really fun to see, and we included on this goal sheet some stuff that people said they wanted to do, set up playtime with their children. So wellness, we recognize, can be just that life-work balance, drinking more water, listening to music, getting to bed before 10:30. So people came up with some really clever things, and in those 5 days, people were chatting about it, and what are you doing? And it just got that excitement up. And then, of course, we had some really great incentives to give to people at the end for participating. But another challenge of ours is that our staff, being in home health care, are not in the office. So many of them are not in the office all the time. They're on the road, they're making visits. So one of our challenges has been communicating and reaching everybody and getting people involved. So that's one of our goals as we go forward. We want to increase participation in these things. So finding new ways to communicate and setting up more time and making sure everybody knows about it, but also what can we do that exists outside of the office? How can we support our staff who are on the road or who go from home to their patient's house? So we do a lot of ergonomic kind of things. What can you do in your car? What simple exercises might you do at your seat or in your car? Snacking on the go, these kind of things. So we have to, as a challenge at our agency, consider who our staff is and how they work and live and make that balance.
Yeah. Our WIC access code today is home health. So what do you think is well, one thing I remember that was a really big goal for you guys was to go smoke-free and have a smoke-free campus. So
absolutely. So that was one of
how was that?
It went much more smoothly with the help of our partners. So having Amy Brewer from the hospital there and 802 Quits resources and so forth really helped us move from. We certainly did not allow smoking or tobacco use while working, but we used to have a little spot outside where folks could go. So we went to a completely smoke-free and tobacco-free campus, and we include the campus of both of our agencies, which is Enosburg and St. Albans, includes our parking lots. So you have to be off-site. So this includes our staff, volunteers, and any visitors to the agency. So we want to protect the safety of our staff from smoking or secondhand smoke, and we want to, of course, protect the safety of our clients. So it meant a lot for us to finally get to that point, and it's gone very smoothly. And of course, we recognize that it can be very difficult. So making that kind of a change, or even going to a quit attempt. So we were able to utilize resources from the Tobacco Cessation to offer our staff a really great incentive. And it models what the hospital does. But when staff reach milestones, so they're 1 month free of smoking or tobacco use, 3 months, 6 months, and a year, at each of those milestones, they receive a $50 Visa debit card.
Oh,
so
wow.
to reward them, good job,
Yeah.
and really, we're so proud of that. And we gave our first card out this month, so
that's
we
great.
were very happy for that.
So they're
Yeah.
saving money from not smoking, from not buying cigarettes, and then they
Yes.
get extra money.
Exactly. Yeah. So we're happy to support anybody wherever they are on their journey. And if they stop and they try again, we just start the clock over and we keep supporting that. So,
Oh, well, that's
yeah.
wonderful.
Yeah.
Well, it has really been a pleasure to work with you and with Home Health, and I appreciate you coming on and sharing all the great work that you're doing.
Thank you. Well, we enjoy it, and we're so happy to have such great partners in our community.
Well, thank you.